Good evening, everyone. Thank you for allowing me to kind of stand up here and share some of my stories with you. I hope I can keep it interesting for you. And please, as I've told my table here, ask lots of questions, okay? So first thing I want to start out with is getting the elephant out of the room, right? What happened with healthcare.gov? It's 4 to 5 years later, people still ask me this question. In fact, I'm going to Japan 2 weeks from now to explain it to a Japanese audience, and then I'll probably be doing the same thing in Singapore, right? It's interesting, it's compelling, and I think there are many so-called lessons learned. I like to think of it as lessons you learn and then apply as you go forward, rather than, oh, that was nice, and then you go down the road and you repeat the same thing again, which tends to happen every once in a while. So very simplistically, let's take a look at something that everybody can understand, right? A timeline, okay? So ACA was signed into law by President Obama in March of 2010, okay? And the administration chose an immovable date of October 1st, 2013 to facilitate a rather long open enrollment period of which to kind of help the program start with a nice, robust enrollment period as of January 1st of 2014, right? So that's a date of which could not be negotiated, would not be negotiated. I've tried several times, and the answer was always no or hell no. So most people look at it and they go, wow, that's 42 months. That's a lot of time, What did you do during those 42 months? Well, took a few vacations, let my staff go. No, the Office of Consumer Information Insurance Oversight was created just a week or two after the law was signed. And there was some talk about, should it be in CMS, because CMS is a big bad, kind of government payer and knows how to implement national programs. But there was also this fear that it was the private insurance market of which the folks that worked in Medicare, Medicaid, Children's Health might have a hard time grasping the idea that there are commercial private insurance types of products and the process in which they become health plan products and such and benefits to be purchased by the consumers would not be kind of well understood, right? So the Secretary and the administration decided to start the office out of the Office of the Secretary. So I had worked with this group since probably late 2008 in thinking about what it would take to implement the public option versus the state-based exchange. I had some experience working on Medicare Part D implementation. I was kind of the de facto systems integrator for the 15 plus systems, and then shepherded them into production, and then subsequently, immediately turned to fixing all the data issues, which I'm sure all of you maybe remember that as well, right? Like premium withhold, right? So, it really kind of teaches you something. So you need to kind of carry that forward. So I was helping them kind of think through what the model and the complexity and the cost would be. But I spent so much time with them that one day I said to the leadership that started that office, I said, look, I feel like I work for you already. Why don't I just come work for you? And I was just kidding around, and they said, we thought you'd never ask. So they did some paperwork, and yes, I got a promotion out of it. I became a CIO for about 5 months, and I'll show you what happens. So first, healthcare.gov, we scrambled and worked at the department level to put up a rather static website. The law said you had to have an insurance portal that consumers can shop for present day insurance products on the individual market. So it's a kind of very static view, and of course this is prior to guaranteed issuance, and so it still had to go through underwriting. So the prices quoted on it wasn't really kind of dynamically going through the eligibility processes and the premium tax credit determination process. But yet we had to comply and kind of threw something up there. And then there was the November 2010 election in which the Tea Partiers, the Republicans, won the House. And that was a danger sign, right? In January 3rd, Jay Angoff, who was the director of the office at the time, called me in his office and says, hey, Henry, we're all going to CMS. And really, it was no surprise to me because what Ohio lacked at the time was the ability to manage grants, contracts, procurements, hiring, training, you name it, right? You're starting out a new organization and you have a bunch of policy folks that never really managed a lot of people before and have no HR skills, have no IT skills. It was really kind of a tough situation. So it was actually a good thing for the organization to kind of be moved to CMS, although people didn't necessarily welcome you with open arms. By April of 2011, there was a small initial budget approved. The Affordable Care Act only came with $1 billion worth of new appropriation monies, but that money had to be spread across multiple agencies and multiple sections of ACA. So there was this paralysis and coming out of all the negotiation and debates between Treasury, IRS, DOD, DHS, HHS, SSA about how much money each agency would get. And by the time, someone said before, a billion here, a billion there, you're talking about real money then. Well, $1 billion is, it pales in comparison to what CMS's budget is. So for example, between Medicare and Medicaid, Marketplace, Children's Health, and the administrative budget of CMS, CMS pumps about $1.3 trillion into the economy every year. It's staggering, right? Medicare fee-for-service alone is $500 billion, okay? Medicare Advantage and Part D, it's about $15 to $18 billion payments per month, right? And Medicaid is another, $450 billion. And so the IT portion of that is just really, really it's a hair, barely a hair on a pie chart if you were to try to show how much we spend on IT. But that one hair represents about $3 to $4 billion, okay? So $1 billion to start a new, kind of program that's for 50 states, potentially up to 50 in DC, and all the back end, all the front end, including paying IRS to do the premium tax credit piece and the 1095 and changing the tax reporting process to include your advanced premium tax credit. That was just kind of this huge debate and argument about how much money everybody need. So we got a little bit of budget, kind of released. So it's already a year later, right? And in September, finally, we got a contract awarded, and the federally facilitated marketplace, or healthcare.gov, as most people call it, contract was awarded. There was a protest on the Data Services Hub, but it was reviewed and awarded in January of 2012. Then we had another election in 2012, a presidential election. And so during this time, prior to the election, there was a lot of sensitivities about, well, how much of this policy do you really want to let the world know in a formal way? And what does the government do in a formal way to let you know about policy? You write regs. And so they started to dissect the number of regs that would be needed, So I think at some point it was over 45 regs were determined, and they were very confusing, and they were written at a very high level because they didn't want to scare anybody or raise, more political, kind of fodder, for the administration. So there was a lot of very kind of strategic, ducking and hiding, which didn't do well for those on the outside of CMS trying to figure out how to plan for this program, and never mind the inside of CMS, trying to wrestle requirements to design and build a system. So in January of 2011, finally some aspects of the logjam, started to kind of open up. So in 2011, the law says that if states do not establish their own insurance exchanges or marketplaces, then the Secretary of HHS will step in and establish one. But states didn't tell us, or there wasn't the kind of this policy framework to kind of enforce what the deadline is. States didn't tell us until January of 2013. So that was the point in which you could start planning on the Medicaid expansion, and then subsequently the non-expansion states, the coordination of the FPL levels, and the various kind of income tests that you have to do when you disaggregate a household applying for benefits, right? So a household composition could be people who are aging into Medicare, people who are qualify for Medicaid, children that can qualify for the CHIP program in their state, and adults that can get a premium tax credit. And you have to be able to evaluate an application. It's a very complex eligibility determination process. Medicaid has been in existence as long as Medicare, and it's still a challenge in most states. And this was a tall order to ask the federal government to build an eligibility determination system in real time. So after the states let us know, we kind of started seriously working on taking those requirements. We had been doing what we called our own version of Agile, which is we would do high-level requirement sprints absent of any policy, and then we would do it again when the policy was formulated, and then we would move into development sprints, and so kind of broke everything up. So it's kind of like a iterative agile. February, OMB has this archaic process called the Paperwork Reduction Act, and what it does is that anything the government prints and puts out in public, and you'll see it in all these forms that you fill out, such as it's actually on the CMS 1500 and the UB forms. If you look at the bottom, it says OMB approved, because they have to do this very kind of archaic evaluation about the burden it places on you to fill out that form. And to this day, believe it or not, OMB looks at the digital world and evaluates it using that old set of lenses as if you were filling out a paper form. So they demanded that we provide them a paper version of the form, which wound up to be a list of 272 questions that needed to be asked, but not all 272 are asked in every situation. It depends on what you trip or trigger as you're going through the enrollment process, right? For example, if you're single and you don't want any kind of assistance, financial assistance, you could just go right on through, you pass the other eligibility verifications, and you can go to plan compare. And so the number of questions you'll encounter are quite different or less than, let's say, a family of 5. But nonetheless, they spent months toiling over that 272 questions, continuously asking, it's a huge burden to expect people to answer all these questions, not even thinking that even if they did, you're creating an online real-time process for eligibility and enrollment and some kind of premium determination right there because of the guaranteed issuance. So, it took them until February to approve it, and that was really the crux of the requirements for building healthcare.gov, because you have to have that approved. Otherwise, you don't understand what the flows are, let alone the coordination in the back end with how you would hit up against the federal authoritative sources, such as that IRS, DHS, SSA, because you needed to know how to orchestrate that. So that came about in February. And there was something else in the health plan issuer world. You appreciate this. In April of 2013, they opened up the QHP submission window. This is after a couple of years of working with NAIC and the SURF system, figuring out that 25 states had to mandatorily submit through SURF. The remainder states would submit through HIOS, and somehow the two sides had to do a massive data exchange and then come together with one harmonized set of data that both were aware of what was being sold on the exchanges. It was a massively complex process. Issuers were not very happy because they're As I was told, their traditional product development timelines were somewhere between 8 and 18 months. We were asking them to do QHP submission 4 months after the regs came out. So of course that first round, of course had its challenges, but 90% of the development teams had to be redirected to support the QHP submission so we can get what I call the supply side done. Because you can't open up, for business until you have your supply. You have to have those QHPs, defined QDPs, before you open up the door. And you needed that data to calculate relative to the service area in the household about the second lowest cost silver plan, of which you then derive the premium tax credit. It's a complex formula, way more than it needed to be. So now we find ourselves in July, and the communications folks wanted to have a soft launch, which is something that I pleaded for many, many times. There's a article that the journalists, FOIA the White House, kind of visitor logs, which I think they're available if you request them. Anybody, you don't have to do a FOIA. And it said that I visited the White House 36 times in 2 years, and I thought about it, and I was like, yeah, that's about right. Because 34 of those 36 times at least, I was pleading with Todd Park to intervene about the madness that was going on with the schedule and with wanting to do, divert resources to do a not really truly a soft launch that would test, the viability of your software and your system, but was really to develop a campaign that says, hey, why don't you come in and tell us about your communication preferences? Sounds simple enough, but it also diverted resources. So we had to accommodate the soft launch, but in essence, it wound up being very revealing about just how bad the software was actually written, on the marketplace side. And we saw all the errors, and it was just pandemonium. We all, I think a team of us, about maybe 150 in total, didn't sleep but maybe 2 hours a day from that point on through the end of the year. And so by now you see, timeline. We had the soft launch, and then we had the real launch on October 2013. So in reality, it's not 42 months. We really had 90% of the requirements to design and develop and deploy in 9 months. And so, you try to get anything done in 9 months. What's the first thing, when you shorten the schedule, when you don't change necessarily scope, even though it wasn't well defined, you don't have enough time, you don't have enough money. In terms of developing systems and software, what's the first thing that goes? You got it, NQA, because, my mission, as I was instructed, was I needed to have something up by October 1st. Doesn't matter how ugly, I had to have something on October 1st. And, throughout this pace, because people weren't making decisions, or they were, kind of playing hide and seek about the policy, what winds up happening is time makes the decision for you, and then you have to make some tough calls. I was accused of, in one of my hearings, did anybody ever see me in a hearing before on C-SPAN or something? Yeah. That's good. You didn't. I looked very frustrated the whole time I was there. I've been to 3 hearings, and probably 10 times that amount of time in this kind of congressional backroom, practice of trying to beat you up, during depositions and try to get you to spill your guts about, what you did wrong. And I never got thrown in jail, so that's because my story never changed. I mean, I just told the story the way it was. I started out the program at the beginning of this timeline with 10 other senior executives. All other 10 were political appointees. By the time 2013 rolled around, I was the only original senior executive left, and I was not a political appointee. Okay, so I have the institutional memory of every little trade-off that was made, and I can explain it. And so that's why I was thrusted up there to tell the story. And the story is what I'm trying to share here with you is that if you thought things were tough, it was 100 times tougher than you thought it was, because we couldn't just work on the requirements. We had to do this dance, this kind of really weird dance I'll tell you how weird. We would have conferences with states to talk about how the eligibility and enrollment process would work, because we had to coordinate with Medicaid. So the eligibility policy folks would get up and we would have a sticky wall. Everybody know what a sticky wall is? Because we could not present the PowerPoint slides. We could not hand anything out. We could not post anything electronically. What we had to do was to print out 8.5 by 11 sheets with arrows and boxes and decision points, and we had to walk people through this sticky wall and build the business process and the interconnections and the dependencies and the data flows while we were talking, and everybody would be able to come up afterwards with their iPad, with their smartphone, and take pictures of it. And that's how information was actually shared, okay? I had to clandestinely send one of my staff members to the state of Oregon with a bunch of enterprise architecture blueprints, the business process diagrams for what we already paid for, that states, if they had it, they wouldn't have to hire a contractor to do. But there was this fear. Everybody remember, for those of us that are old enough, when Bill Clinton gave his State of the Union speech and announced that Hillary Clinton would be leading the healthcare reform effort, then Senator Dole at the end, doing the opposite parties, you kind of message or recap or rebuttal, sat at the corner of a desk with a big old, like a 4x6 chart behind him, and it with all these boxes and lines, and it was meant to scare people about how complex healthcare would be if the Democrats went through with healthcare reform. And that same, a lot of the same staff that actually worked on that effort was in the White House during this time, and they remembered that, and that's why they didn't want anything like business process diagrams, data flows, or anything to get out in public, because they thought that that would scare people away. And not knowing that on the internet, everybody was drawing their own anyway, right? So this kind of really kind of reveals itself about how unnecessarily challenging it was. But we still managed to get it done. People pick on me all the time, and they say, well, yeah, the damn system only enrolled 6 people on the first day, and I was like, that's more than 0. Okay. All right. I don't like to pick on the state of Oregon, right? The state of Oregon took $160 million in grants, right? Went a 100% data center on a Oracle solution, right? And for the first 10, 11 months, they couldn't enroll anyone online, and they came to us, and then we brought them into the marketplace in year 2, and they spent $160 million and got nothing, okay? We spent first year, probably $360 million, but we were supporting 36 states. Okay, so it was a kind of a huge challenge. I just like to put things in kind of perspective for everybody. Has the battery died? Oh, here we go. All right. Many people. One of the things I do as architect or just a tech guy, ops guy, is try to explain to people in visual terms, about what's involved. And I developed this, and I have a couple others to share you too, to show you that to decompose all the key functions of what had to be done. And there's this first kind of step in the problem, right? Is that you're charged with creating an online real-time eligibility verification, eligibility determination, premium tax credit determination, show plans with guaranteed issuance, with the right premium and the right premium tax credit offset, all in the same session, right? And I turn around and I look at my experiences of working with SSA and IRS and other agencies during things like Part D and premium withhold, and I just kind of really got scared that these agencies, they have very, very brittle systems, and just like CMS, fee-for-service claims processing, and they're definitely afraid of opening up for direct connections to anything new. Like during Part D, SSA would build secondary, like non-operational databases that would be the points in which you would talk to do things such as update premium withhold status and things like that. And then the next day they would take those transactions, evaluate them, and say, oh, it's safe to introduce in our systems, and then they would process it. No such thing as real-time web service or anything, because it was just too dangerous. And I get it, when you're running, Social Security Administration and you're doing all these entitlement benefits, you want things to be stable. So I get it. But here I'm on the other side trying to drive this, it's a world change for them. And the present day way of how programs at the state level do business with the federal government, whether it's transportation, healthcare, human services, and such, is that they negotiate